The shortage of 600 nurses at the Georgetown Public Hospital is having an impact on the institution. Chief Executive Officer of the GPHC, Robbie Rambaran, said the overall complement is about 1,400 nurses.
Nurses runs a hospital. I would go home after spending an average of 12 hours here. The doctors go home, all of us go home. But the nurses is continuity, and the doctors will go, they will do their rounding. They depend on the nurses to do their vitals, on medicine, give the patient their medicine, their food. So nurses are the most important resources in the hospital. I always say that, and they are the heart of the hospital. And certainly it will affect care. There's no doubt about it.
He said steps have been taken to fill that gap.
Yeah, sure. We got about, in the last couple of months, we got about 40, I think, nurses from Cuba. I know the Ministry of Health, they are working towards see where else they can bring the nurses in. Nursing is a global issue. It's not a Guyana issue. It's a global issue, and you are seeing less and less people are coming into healthcare since COVID pandemic. Even there was an article on the Economist website recently about the Americans are not going into medicine anymore. They are more into these IT and these tech, and most of the doctors are people really from India. So there is a less human resource that is going into the health industry, the field of healthcare.
Fordy pointed out that the shortage of nurses is one of the many challenges facing the hospital.
There are quite a few. Nursing is a challenge. We all know it's no secret that there's a lot of shortages of nurses. We got a few, I think 15 came from Cuba recently. We are engaging other agencies to get more nurses, but one of our major constraints here is our nursing care. We have been doing a lot of groundbreaking surgery. We are training our physicians. We have a lot of training program for nurses. Unfortunately, sometimes we don't have the intake to roll out some of the programs because of the nursing shortages. And there are many others, you know. I think we are trying now to have a new culture, a new behavior pattern, behavior changes, and sometimes you find the way we oftentimes, frankly, you will hear people will say the way they communicate it too. And we know the old saying is now what you say, but it's how you say it. And we have those challenges to deal with as well. A lot of times you will hear that someone at the hospital was rude to a patient or to a relative. But I can tell you there are many instances where our staff aren't the aggressors. And I think this whole culture, but the old public service mentality, and you go anywhere that there is a public service, there is like a barrier, there is a way that you go there and intend to meet people of a certain behavior, and you put up that barrier and resistance. So if you go there and any of these things, you snap. People are human. Some of them will react. At the end of the day, people will react because we are all just humans. Everybody have their little social ills that they are dealing with at the end of the day. And if you are coming to us aggressively, they will react. I mean, it's no excuse. I keep telling our staff, you have to keep your calm, be patient, just relax, move, just don't escalate in issues. So those are some of the issues that we have. The way people approach us sometimes are not of the friendliest. And many times the story that you hear and the complaints that you hear is really and truly far from the reality.
The exodus of nurses and doctors has been ongoing for some time, with many opting for greener pastures and better remuneration in countries like the United Kingdom, Canada, the United States, and other parts of the world.